In the 1960s, Americans paid for about half of their medical expenses out of pocket. They went to the doctor, they got labs, they got x-rays, they just paid cash. It's very simple, it's very cheap. Everything went along fine, and then everything changed in 1973 with the passage of the HMO Act. The insurance companies gave us a tantalizing proposition. What if you pay one price and we cover all your medical services? It sounded great. Everybody said, yeah, let's do it. But now we're understanding the true problems with that. And the first problem is we don't see prices of medical services anymore. We don't know if we got a great deal or a terrible deal. And the second part is we took something that was simple and made it complex. Now you take a doctor's visit and you're running through the insurance process. All of a sudden, you have to get permission to see a doctor. Doctors are in networks, so they're not in networks. That wasn't happening before. And it also took something that was inexpensive and made it expensive. And the third thing that happened was costs exploded. Now we're at this tipping point in our healthcare. The average family is paying about $30,000 in premiums and deductibles before their insurance kicks in. And what happens when it kicks in? No one knows because you don't know, is it going to be covered if I go to the doctor? What happens? You have no idea. You don't really know, is that doctor in network or that hospital network? There's surprises. And then there's delays, there's denials of care. What are we even getting? People are extremely frustrated with it. And I want to share with the viewers, and there's a lot of misconception about this, physicians are as frustrated as the patients. We hate dealing with insurance. We are terrorized by insurance just like you are. A lot of patients sit there and they think, the doctors are wanting us to be sick and that's how they make That's absolutely not true. We want you to be well. We are frustrated. About 80% of physicians right now are employed. And I would say to everybody who's employed, if you're a physician, go out on your own. It's not worth it. And I know Andy's written a letter to physicians. He said, drop insurance. Throw the shackles off, which I love that. So everybody's wondering, what are the options? Now, millions of Americans can't afford insurance, especially with the ACA subsidies expiring. People are like, what am I going to do? A lot of millions are going without insurance. Well, in this episode, we're going to talk about an alternative to health insurance. You don't have to go without a safety net. We have something here today that's very exciting. I have the pleasure of handing Andy Schoonover here, the CEO of Crowd Health. He's going to walk you through his great system. And this podcast is for educational purposes only, not medical advice, not inducement to buy any products, and as always, seek the advice of a physician. Andy, thank you so much for being here this morning.
Thanks for having me.
Absolutely. Now, why did you start Crowd Health?
Yeah, this is actually my second healthcare company. Never thought I was going to do another healthcare company after the first one. Like you, I'm very frustrated with healthcare, the regulatory overhang, just the difficulty to innovate within healthcare. And so
You're right.
After my first one, which I sold, I went and I got what I thought was my only option, which was an Obamacare plan. Most of us are employed through are insured through our employer. But I didn't have an employer anymore. So I had to go to the Affordable Care Act, and I think it was about $1,200 for me, my wife, and my two girls. And I kind of joke it worked until I had to use it. My little one, who had one at the time, was having a recurring ear infection. So we went to the ear, nose, and throat doc, who told her she had a hole in her eardrum. It's like, no big deal. We just got to get tubes in her ears. So we did everything right. We went in network, and 15 minutes later, she came out and she was almost good as new. Her screaming bloody murder all night long disappeared. She was great. And she's like, perfect. Then I got the bill from my hospital first, and it was $8,000 for a 15-minute procedure. I'm just like, holy cow.
It's crazy.
Are you kidding me? This is crazy. But hey, this is what health insurance is for. And we were at the end of the year. Right. And so we were, had gotten most of the way through our deductible. And so I was like, all right, well, this is what health insurance is for. And then I got a note in the mail from my health insurance company that they said it was medically unnecessary, and so they weren't going to pay for it. I'm like, hold on a second. My daughter had a hole in her eardrum. Right. How is that not medically necessary?
Absolutely.
And so we went through 2 rounds of appeals. And at the end of the day, the health insurance plan was like, nope, we're not paying for it. So I had to stroke an $8,000 check to get this procedure paid for. And it was at that moment, I was like, something is totally screwed up with our system. And so I quit health insurance, and I was like, we got to find another way of doing this. And, I can go kind of into the whole story, but ultimately the product of that analysis of how to do this better was Crowd Health, which we started in 2021.
Well, I'm so glad that you did that. When you had that procedure done, was that at a hospital or ambulatory surgery center?
Yeah, if I would only known then what I know now.
Yeah.
It was done at a hospital. It was the only hospital in network that would do it with the insurance plan that I had. I've learned now that ambulatory surgery centers are a much better place to be doing these outpatient procedures. Dr. Mary Tally Bowden, who has been in the news here recently with her battle with the Texas Medical Board, actually responded on X. It was Twitter back then. When I told them I can't believe, I posted something on X. I said, I can't believe this. This is $8,000 for a 15-minute procedure. And she responded and she's like, oh, yeah, we do these for $2,000 all day long. And I'm like, wait, hold on a second. What? Like, she's like, yeah, if you pay in cash direct, we'll do them for $2,000. I'm just like, this is crazy to me.
Yeah.
That there's a $6,000 difference between paying directly in an ambulatory surgery center versus paying indirectly through health insurance through a hospital. I could have saved myself $6,000 if I would have known that information. And so, I've gathered probably a dozen of those little tips, things that can help you massively reduce your costs. And we've kind of propagated that out amongst 25,000 people now in our community who are now getting much, much lower rates on their procedures as a result of paying directly, staying out of the hospital to do some of these outpatient procedures. And as a result of that, are saving, a family of four is saving $10,000 a year on their healthcare expenses by just using some of these tips that we've gathered over the last 5 or 6 years.
Now, the one thing is interesting, and I encourage everybody who's listening, please go to the Crowd Health website. And I'm going to say this is the best website I've ever seen. And I love doing deep dives, and you can do incredible deep dives on this website. You can go through the media and blog section. You can do the transparency reports. You could really get a great sense of this. And when I first heard about this, I was a little skeptical, but physicians always are. But there was 2 people on X who were big proponents of this. And there's people that both of them I really respect a lot. One was Dr. Noah Kaufman, and the second one was Tiffany Ryder, who's a PA. And Noah's a big Bitcoiner. And I was like, I have to really check this out. So I really compliment you for the website. It really lays out the whole plan so well. It's unbelievably. And I love that you really have simplified healthcare. I love when people come from outside of healthcare and say, you know what? I'm going to simplify. There's no reason for it to be complex. And healthcare delivery can be complex, but healthcare financing, the paying for healthcare should be very easy. I mean, there's no reason for it. But could you explain to us how it starts? Like if I want to sign up to Crowd Health, how do I sign up? And how much do I pay each month? And go through the system a little bit for us.
Yeah, first, Dr. Kaufman and Tiffany are, have become friends of mine. They started as members of Crowd Health. They're now friends. And the interesting thing about Crowd Health is as we track kind of the occupations of our members, and the number 2 occupation are clinicians. The number 1 is entrepreneurs, gig workers, freelancers, so kind of an entrepreneurial group. And then number 2 are clinicians. And I think that we're, that's a product of clinicians seeing how broken the system is, firsthand. And so we've got tons of clinicians who are involved with Crowd Health. And that's pretty cool that we can serve them.
That says a lot right there, Andy. That really does.
Yeah, exactly. And like I said, like you said, clinicians are seeing this, that,
yes,
you can go in and what should be a very simple process is obfuscated, to use, the most mild term possible, probably, yes, by health insurance plans and hospital systems. And as a result of that, through kind of this opaque nature in which they work and bill, they are reaping profits, unfortunately. And so, Crowd Health, it started with a simple concept, which is what I was seeing is that if you could pay directly, you could get better rates.
Mm-hmm.
And after I quit my health insurance, I had to pay that $8,000 bill. I called my health insurance company. And I was like, I quit. I'm not doing this anymore. If you're not going to pay my bills, I'm not going to pay your bills. And we started paying directly in cash or, credit card. And what I found is they're like, oh, great. You're paying directly. Great. We'll give you a discount. And oftentimes we're seeing 20, 30, 40, 50% discounts. I just mentioned my daughter would have been 75% less if I would have just paid directly and gone to the right place. And so I was like, man, let's see if we can scale this. And so ultimately what we are is a platform to enable people who are willing to help, connect them to people who need help. And now we're doing that across 25,000 people. So I'll give you a real life example. We had a woman here in Austin who tore her ACL playing pickleball. Mm-hmm. She went to the emergency room. They're like, yep, you tore your ACL. Let's give you to the hospital system's orthopedic surgeon, and they will do, repair your ACL, and it'll be $24,000. And so she calls us and she says, I'm so sorry, guys. I just joined Crowd Health and now I have an ACL tear. I feel so bad. It's $24,000. He's like, well, do you mind if we, look around and see? And we actually knew of another orthopedic surgeon in town who does a lot of I'm in Austin, who does a lot of the joints for the University of Texas Athletic Department. Mm. And so we know he's good. And we call him. He's like, oh yeah, if you pay me directly before the surgery, I'll do it for $12,000. That's all in. So it went from $24,000 to $12,000. It went from a hospital to an ambulatory surgery center. Mm-hmm. It went from them having to bill health insurance kind of price to a direct pay price. And so all of these things are showing how inefficient the current system is. And so what we went and did is we went to, I think it was 120 people, and we asked for $100 from 120 people in our community. They sent $100 to our member. Our member then had that $12,000 to go and pay for that surgery directly at the point of care. And then, did all our PT after that, and all that was funded by the community too. And so in essence, we have this peer-to-peer funding mechanism that are funding these bills so that you can pay directly, as opposed to the doctor having to go and fight to get paid from a health insurance company. It doesn't make much sense, at least to me, prior to getting into this. I would have thought that United Healthcare, which is the top 10 largest companies in the planet in terms of revenue, would be able to get me really good prices. But in fact, it's the exact opposite. I can get much better prices than United Healthcare can, because the doctor now doesn't have to fight United Healthcare right, to get paid. There was a study, I think 9 or 12 months ago, that said doctors spend on average of 16 hours a week fighting with health insurance plans to get paid. The administrative, bureaucratic process. It's like, imagine, if you're a doctor, so you get this, but imagine for those people listening, if you had to fight your employer 2 days a week just to get paid. That's not a very productive 2 days a week. What if I gave you back those 2 days a week so that you could actually be productive? Well, that's what's happening with doctors, is we're giving them back that time, and therefore they can spend more time with you. They can generate more revenue, and therefore they can, charge less price, because their margin on you is much greater now that they don't have to, fight the insurance company. So that's ultimately the reasons why you can get much better pricing with paying directly as opposed to buying through health insurance.
Well, there's a couple of different things that you cracked the code on. The first thing is there's no correlation in healthcare between the price and the quality. And as everybody assumes, there'd be people, and I talk about this on X all the time, you can get a CAT scan for $350. And people are like, well, this is, a discount CAT scan center. I'm like, no, it's actually an imaging center that's independent from the hospital. It actually looks like a med spa when you go in. They smile at you and treat you well. It's very convenient. And
it's a much better experience.
It's a much better experience. That's the part that's what is missing in healthcare. You don't get treated well in the traditional healthcare system. You get treated as an annoyance. You come into the emergency room, you're going to get minimum $5,000 bill. No one's sitting there smiling at you when you come in. And, so that's the part that is missing with that human. And I love from your system, and I'm not a member because I'm too old to be a member. But when I'm reading through it, you can tell that it's set up very humanistic. You want to take care of the person. And that's why every physician goes into medicine. You want to take care of people. And like you said, you don't want to be talking to United Health. You don't want to do a peer-to-peer with somebody from a different specialty who has no idea what the heck you're talking about and is just trying to stall, delay. And really what we're doing is we're looking at Main Street versus Wall Street. United Health is Wall Street, and they have one incentive. The CEO gets paid by the stock price. Stock price goes up, he gets paid more. And the only way to get the stock price go up is delay, deny care. It's not a big mystery.
Maximization.
Absolutely. Where you're sitting there on Main Street, you're like, okay, I'm setting this up. I want to get patients the care they need. So it's a whole, and that's what physicians do. And part of it, even if a physician would make less with cash paying, but you didn't have the hassles of dealing with the insurance, it's worth it. It is soul crushing for physicians. Physicians are retiring early. They're getting burnt out. And it is crazy. And I had an instance with United Health, thank you, Optum, where they tried to claw back money, and it was a couple of years after treatment's given that, you go through these processes. We had to go through this huge ordeal with 40 cases. They accuse you like you're a criminal, you did something wrong. And at the end of it, they say, oh, actually, you didn't do anything wrong. They don't say, we're sorry, we harassed you. And they just said, we're surprised you actually even push back. Most people just pay because there's such an administrative burden to do that. So that's a part so I want patients to know we're on your side. And I love this. When you pay direct, then it's very apparent, that works out great. And
you made a really good point, but which is like, we are conditioned to think that higher price means higher quality.
Mm-hmm.
If you go to the Ritz-Carlton and pay $500 a night versus the Courtyard, which is $150 a night, you're going to get a better experience at the Ritz-Carlton, clearly. With healthcare, it almost feels like it's the opposite. The more you're paying, the worse care you're getting. I kind of think about it like this, where, this orthopedic surgeon, for example, he does, 2 or 3 knees a day.
Mm-hmm.
And therefore, if he sees something that's irregular, he's probably have seen it dozens and dozens of times.
Right.
And therefore, the outcomes are going to be way better. And he can do them faster. And so imagine that versus somebody who does 2 or 3 knees a month. The guy who does 2 or 3 knees a day is going to be better at it, more efficient at it, lower cost at it. And that's the person you want to go to. You don't want to go to the high cost person who does 2 or 3 a month. And so in our minds, we have to recondition ourselves to think that more expensive does not equal better. And in fact, what you're saying is that oftentimes, let's talk about these labs, imaging centers, or these labs. These oftentimes are the exact same place that you go for with your insurance, but you're going to pay 2 or 3 times more through insurance than if you pay, directly. So that's one of the challenges that we have to get people to understand and recognize is when you pay directly, you're going to get better pricing, even though they may be the exact same place that you go to get your health insurance. When I had health insurance, my labs every year was something like $500-$600, $700 sometimes. When I had a lot of labs, I get my labs now for somewhere between $100 and $200 depending upon what I order, and so I cut it by 66% just by paying directly. And so there is huge savings to be had if you can rip out that health insurance middleman, reestablish the doctor-patient relationship, and I think you get way better care at a much lower price. If I come to you and say, hey, doc, I have health insurance, ultimately you have to provide me care associated with what the health insurance company, will dictate. It's dictated care from the insurance company, which is why I think doctors are so worn out. They're like, I'm a doctor.
Right.
Like, I should be able to do what I need to do with my patient to get them better. But if I go into you and say, hey, I'm paying you directly, there's no middlemen. It's me and you. I am your customer. Now you can do exactly what's right for me and my health without a government or an insurance company or an employer or anybody else getting in the middle of that. It's between me and you, which is the way that it should ultimately be. And so when I go in and I say I'm cash pay, you see the doctor's faces, they're like, whoa, really? Like, this is great. I remember I was in the cardiologist like a year and a half ago. I had some chest pain. Fortunately, it was a pinched nerve and nothing bad. But I remember going in, I was like, I'm cash pay. And he looked at me weird, like, really? I'm like, yeah. And I was like, great. you need to go do a stress echo test down the hall. I was like, how much is that? And I was like, he's like, it's like $200 or $250. I'm like, really? He's like, yeah, I put this on X, again, Twitter back at the time.
Yeah.
And I put this on X. I just got my stress echo test for $250. And a guy responded to me and was like, dude, I just had a stress echo test with my insurance and it was $5,000. And I'm like, this is ridiculous.
It's crazy.
Right? And the power of being able to ditch health insurance, exit the system, and pay directly, it's going to save you a ton of money. And you're going to get better care from my perspective.
And Dr. Keith Smith from the Surgery Center, Oklahoma.
Oh, yeah, we love Dr. Smith.
Testified in the Senate, and they had a hearing, and he talked about this. And he said the reason why it's more expensive with a poor quality surgeon is part of what you said, they don't have the volume, but they have worse outcomes. So if you're responsible, if you have a bundle and if you're responsible for all the cost, you don't really know how to factor in all the complications. Where his center, they have top quality people. They know how to do it. They know how to price it. And, I would say to all the physicians listening here, I think what we have to do is double down on customer service. I mean, certainly quality is always important, but customer service. And I think we have to offer people bundles of care because that's, if you're an employer and you say somebody's going to need a knee surgery, you don't want to get 15 bills. You want one bill and let the surgery center figure it out. You guys in the back of the room, figure it out, cut it out. We don't really care. Just give us one bill. So I think we have to do a better job with that. And I'm a huge physician advocate, but that's one area I think we have to meet the needs of patients and employers and make it simple. And I love that you're simple. Your system is so simple. And, you have the two parts, the fixed part, I would say administrative, the $60 a month cost. But there's tremendous value in this $60 that you're charging. And that's really, from my understanding, that's the only profit center for you because the other money is going into the pool for expenses. So you don't touch that other money. So the $60 is all you have. And could you talk about what services do you provide for that $60?
Yeah. So as you said, there's two components of what we do. One is the $60, which that comes directly to Crowd Health. And for $60, you get a care advocate. And so you get a personal care advocate. You talk to the same person every time. One of the things I hated about health insurance when I was dealing with it, when I would call in, I'd have to wait on the line for 20 minutes. I would talk to somebody in some foreign country. I would tell them my whole story and they'd be like, oh, I'm sorry, I'm the wrong person. Then they would punt me to somebody else and I'd wait for another 20 minutes. I mean, it was like one of the most, if I had hair, I would have pulled my hair out. So I was like, you know what? I really want just somebody I can talk to. Like, let me schedule a call with somebody so I can talk to somebody that knows me, knows my story. And so you got a personal care advocate internally. So that's a part of that 60. You also have a team of people who will negotiate bills for you. And so if you go into the hospital, if you do tear your ACL, we've got a team of people who will actually go and find great doctors for you. Or if you have a bill that you need negotiated, can negotiate that bill for you. So I guess those are two different pieces. We have a negotiation team who will negotiate bills for you. Then we have another team who can find a great doctor for you based upon all of our other members who are in your area who've also gone to doctors. So we provide, the cool part about this is we got 25,000 people. They're all going to doctors. They're like, this doctor is great or this doctor is not great. And we put that in a database and then we share it back to our community so they know who the great doctors are in their area who can give them a really, a fair price. So that's a part of that $65 as well. And then we also enable you to crowdfund your medical bills. And so the second component is one payment to somebody else in the community once a month. So we will ask you once a month to help somebody else out in the community. And that's up to $140 if you're a single person or up to $420 if you're a family of four or more. And that money will go directly to somebody else to help them with their medical event. And so you'll just be asked once a month to help somebody with their medical event. It's kind of cool because now I know exactly where my money is going. It's a peer-to-peer transaction. We don't get in the middle of it. I'm helping Sally in Des Moines, with her pregnancy. And this is a really kind of neat thing where I'm not sending it to United Healthcare. and paying for the CEO's massive salary. I'm paying it directly to somebody else. And so this transparency is really, really important to us. And I think really differentiates us not only versus health insurance, but also health shares and some of the other alternatives out there.
And I also want to add a couple things that you have, because I'm really impressed with this $60 value. I'll be honest with you. You have unlimited telehealth with a physician, which is phenomenal, because a lot of people, you have a cough, cold, maybe I need, sore throat. That's extremely helpful. And then sometimes just in deciding, I need to go to an urgent care or I need to go to the emergency room, they can help you sort through some of that. And then the other part, I think nowadays, is you have that unlimited talk therapy. Talk therapy. Thank you. And I think that's phenomenal, because so many people have anxiety, and I know you realize this as well. So many people just get put on SSRIs, get put on antidepressants really quick. But if you could do talk therapy, I think that's a great place to start, and it's going to be great for postpartum depression and, which comes up a lot. There's lots of changes. Moms need a lot of support afterwards. So I love that you have those two things. I mean, that's worth a lot. So I can't stress how helpful that is for people to have both of those. I think those are great services. And then you have the discounted prescription drugs, which works well.
Yeah, discount
Discount
prescription card. Yep,
yeah,
which works super well. Again, you go in and we've seen a lot of these on X as of late, where people go into their get medications, and they say how much is it, and they're like, oh, it's $7, and he's like, but then they're like, well, I have insurance. They're like, oh, I'm sorry, it's not $7, it's $94.
Yeah,
and people are like, wait, what? What's going on? So you get access to a discount prescription card as well.
What people don't realize with the prescriptions is that's one of the essential benefits under Obamacare, which means that you have to have prescription drug coverage. Now, they don't break it out and they don't tell you, and it's probably about 20% of your premiums. And I was talking to a young woman the other day, and she's probably paying $3,000 a year for her prescription drug benefit. Then she has co-pays. So she's probably paying $3,100 a year for two medications, and the cash price for those for the year is $48. So that's a part. All this stuff is hidden, because if anybody could see all this, everybody be up in arms. They'd be calling their congressman like, why am I paying $3,100 for $48? So that's what people, and 90% of drugs are generic, and there's great generics. And if you have insurance, a lot of times the middlemen, the pharmacy benefit managers, will take generics off the formularies and put a more expensive brand name on there. So they're not only are they not getting you the best price, they're actively getting you the worst price. That's the other part of it, which people don't realize with insurance. We think that the CEO of United Health is sitting there and saying, I have to get Marge Smith the best price in Des Moines, Iowa for her medication today. That's my goal. And of course that's not, but no, I love the transparency. The other thing, I was looking at your transparency files and that's phenomenal. Could you talk about what's in those?
Yeah, I mean, I think that, ultimately what we're trying to do is build trust with our community. And I think that you can build trust through transparency. And so what we do is every month we actually release a transparency file, which is basically all of the bills that we get into Crowd Health and then the status of those bills. So you can see, it came in, it got funded or it didn't get funded, and the reason why it didn't get funded. It tells you where all the money went that month, how much money went that month. We even put all the way down at the bottom underneath is all underneath the bills. We have our what do we call it? We call it the complaints log. We actually show people all the times that our members complained this month too, and how we satisfied that complaint. So we want to have like maximal transparency. And so you can go and take a look at that. It's on our website, joincrowdhealth.com. I think it's under more, and then transparency files. And so that's a pretty neat part of what we do. Is we're not trying to hide anything.
No, it's great.
We're trying to give you as much information as possible. And I think this is, a pretty interesting differentiator versus health insurance, who are trying to hide as much as possible so that people don't really understand. I mean, It's funny. I went to Stanford and my roommate was the number 2 in our class. And he's like, there's really only one thing I don't understand in this world. Like I can't grasp. He's a wicked smart guy. He's like, it's the explanation of benefits I get from my health insurance company. Like I'm pretty good at math and this math doesn't math. Like there's no way for me to get from this number to this number. And so there's like such like craziness that goes on these explanation benefits. Just real quick, I got a funny story where I talked to some woman who was worked at a consulting company, very well-known consulting company. Everybody would know what it is. And basically what their task is to take CPT codes and DRG codes and then translate them for somebody like me who doesn't understand healthcare. Because CPT codes, the actual translation is oftentimes like gobbledygook. Like you have no idea what it means. And so they're like, okay, so they took all CPT codes, all the DRG codes, and they like translated them. And so this big health insurance plan, I won't say which one it is, but it was like, great, we're going to do this. And so they did it. And so people started getting explanation of benefits with like a real description of what services they got. And they said the phones lit up at the insurance company because people were like, I didn't get this service. Like, what are you talking about? Like, she said there was people with baby girls coming home with circumcisions on their explanation of benefits. And people are like, I didn't get a circumcision. I have a baby girl. And so the insurance company actually stopped doing it because they were getting so inundated with feedback. And so they went back to being totally, opaque. Again, I'm trying to use the kindest terms possible.
Absolutely.
And so that's like a real world example of these insurance companies actually want you to be confused so that you don't ask questions.
Oh, absolutely. Absolutely.
And so that's one of the huge challenges in healthcare.
No, you're right. And nothing is more confusing than when you go to the hospital. You walk in the emergency room and I've written about this on X. You look at the price of a hospital bed. You could stay at the Four Seasons in a suite for the price of a hospital bed. And that's just a hospital bed. That doesn't include IVs, medications, anything else. It's like, why is this so high? And why is the highest one is the nonprofit hospitals. They're almost $1,000 higher than the for-profit hospitals. They're higher than state and federal government hospitals. They're the highest, and they're not paying any taxes. Why would they be higher? They should be lower. I mean, none of this makes absolutely any sense.
Nonprofits are the most egregious billers on the planet.
Yes.
In hospital planet. And so I think you made a comment on one of our posts. We had this really fun kind of AI generated video about the health insurance space. And one of the examples we gave was a $5,000 bag of saline solution.
Yes.
And so, unfortunately about 2 years ago, I was on a podcast like this and I could not put 2 words together. Like I couldn't put a sentence together. And about a year and a half before that, my dad had a stroke. So I thought I was having a stroke. So I went to the hospital and, I was in overnight and I had this saline drip going into me. And I asked, I was like, what's this saline drip for? They're like, oh, we just do this with every patient. And I was like, am I, dehydrated? They're like, no, you're not dehydrated. You're fine. Like, okay, whatever. And so I get the bill and I kid you not, that saline bag, 1,000 milliliters of saline was $5,000.
Oh my gosh. Wow.
$5,000.
Wow.
I have the bill.
Wow. That is insane.
And the hospital bought that saline bag for about $2.
Wow.
$3, $2 to $3, depending upon volumes.
That is good.
And I'm like,
wow.
And it wasn't even needed. It wasn't even needed. I wasn't even dehydrated.
Wow.
They're just doing it to do it. And I'm like,
wow,
this doesn't make any sense.
No, it doesn't. And there's such good deals out there. My wife and I unfortunately had gotten sick over my last birthday. We're staying at a hotel and we're just throwing up. We just had the stomach flu and I was like, I'm not going to the ER. And then I found a nurse practitioner who would come to the hotel room, put an IV in. I got 2 liters IV, with Zofran, some other medications there. And the bill was $350. I mean, this is, is such great, a nice lady. And then she, first, my wife got sick first. Then I was like, you're probably going to be seeing us again. I got sick the next day. And then my daughter got sick the day after. It took care of all of us. But I mean, there's so much good value if you just throw the insurance out the window. And, I think the other thing, it's really hard because everybody got used to this idea, like my insurance, I paid for it, they should cover everything. It's like, that's the wrong way to think. And most people never meet their deductible. So they're paying cash anyway. They just don't realize it.
Right.
So you have to throw that out.
Your car insurance doesn't pay everything.
Exactly. So why are we insuring $6 prescriptions? And it doesn't make any sense. But the other thing I learned from
I kind of joked real quick. I was like,
sure.
if our car insurance paid for an oil change, our oil change would be $600 or $700.
Absolutely. And you have to get it pre-authorized.
And so, one example, as I saw, was whether you agree with this or not, but like birth control was before Obamacare was you pay directly for it. It wasn't reimbursed by your healthcare. But Obamacare then made it a part of minimum essential coverage. And so they had to pay for it.
Yes.
And so birth control, and this is something that the Fed released, actually the price was going down over time. As soon as Obamacare started paying for it, guess what? Whoop! And now I think it's 2 or 3 times what it was the year before Obamacare went into existence. And so once you start having a third party pay for something and you not pay for it, the cost is going to go up. In essence, you're going to the grocery store with somebody else's credit card.
Yes.
And so you don't care what the price is. You don't care what the quantity is. You're just going to acquire because you have no incentive to do otherwise. And so I'm a huge, proponent of people should be paying more out of pocket and the insurance company should be paying less. The more consumerism in healthcare, the better. The prices will come down. The oil changes will stay at $29.99 and not go up to $600. That's ultimately what's happening in healthcare right now. Lack of consumerism.
No, you're 100% right. I mean, it's funny. There was a study, I think it was the American Enterprise Institute put out, and they compared cosmetic surgery rate of increase, their CPI for that. And it was over, I think, 98 to 2020. And it went up at 38%. And then overall CPI went up at 66%. So all these people getting cosmetic surgery are much better shoppers. That's the other lie that they say in healthcare. Oh, it's too complicated. People can't shop for care. I'm like, really? They're on Amazon all day shopping they shop for cars with, 30,000 different features in cars. And they could do that. But you said you can't figure out how to get a CAT scan? That's baloney. But all the people getting cosmetic care were able to shop and they got a better deal. And then medical CPI over the same time went up 138%. And hospital CPI went up 240%. So the problem is there's no shopping. And exactly what you said, we need to shop for it. The other thing was fascinating on the transparency files is to see where the money went. And about 40%, it looked like each month, about 40% went to maternity and wellness. So I would say it has nothing to do with the disease because maternity is not a disease, obviously. And then 40% went to accidents because you have kind of an active membership. And it was really a small amount went to illnesses. So that was fascinating just to kind of see where the money's going. And I know there's exclusions in your system because you can't be 65 or over. And then you have weight exclusion. I think it's 220 for women, 240 for guys. And then for chronic illnesses, you're not covered the first 2 years. And the third year, I think it's 25,000 limitation on that. Sure. So the thing I'm going to say is that this is not a plan that would work for everybody. And one of the things that I post a lot on X and people always say, well, your ideas aren't going to work for everybody. There's no idea in healthcare is going to work for everybody. However, if you have a plan that can work for millions of people, that's wonderful. The second thing I would say, Andy, is your principles can work. Those principles can be taken and applied to other like self-funded insurance. Yep. Why not make it simple? Why not I love the idea of the care coordinator. You have an individual person. And I also I'm a huge nerd. Okay. So I went to look at the people who work for us. And that was the funniest description of these people, but you can tell they're just quirky, funny people. They're nice people. And, but why can't self-funded plans do that? Why can't they lower the price, do shopping, treat you as an individual, somebody that's priced? If you have an accident, I could tell when they call up the care coordinator, they don't do the United Health game and say, well, why are you calling us? And let's try to delay the care. You're just like, how can we help you? That, it's a whole different attitude. So we need to take your principles, the Andy principles, I'm going to call them, and apply them to other types of insurance.
Yeah, well, I appreciate that. I mean, I think we have very much a love your neighbor type of approach. Um, my faith is important to me, and so I kind of slip that into places that people don't see. But I think love your neighbor is ultimately one of the greatest rules out there, the greatest laws out there, and so we try to do that well. And I think that I actually task my care advocates every month to spend a certain amount of money on our members that's outside of what they normally would expect, and so all of our moms are expecting moms going to the hospital get a little care package with a robe and good socks and lip balm. And I asked my wife, I was like, "Hey, when you were going and having our kids, like, what would you have liked?" And she's like, "Those robes at the hospital, they are terrible.
Mm-hmm.
The socks are terrible." And I'm always like chapped lips in there. I don't know what they do in those hospitals. And so we're like, all right, let's give these moms this. And then we have a little baby package too for the little babies. One cool, real quick story is that we had a little guy in Colorado who was hiking with his dad. He fell, hit his head on a rock, and slit open his cheek. I believe it was his cheek. Well, he got that funded by the community, and it was totally fine. And so we called the mom and was like, "Say, how's he doing? Is he doing okay?" He's like, "Man, physically he's doing fine, but emotionally he's struggling with a little, PTSD from falling while hiking, and so he's not hiking with his dad anymore." And so our care advocate bought him a little climbing kit that he could put in his living room. And so the little guy started climbing on his climbing kit, and the mom called us back and was like, "You won't believe this. Because of your little climbing kit, he's comfortable going back out with his dad hiking again." And so it was like a $60 little climbing kit or something like that. But it was one little way that we could say, "Hey, like, we want to legit love our members well, and have them feel it." And I think that ultimately within healthcare, it's not really healthcare, is it? I mean, because it doesn't feel like there's a lot of care there. Ultimately, at least from your insurance plan, it feels like it's an enemy as opposed to an ally.
True.
And so ultimately, we're trying to be your ally and helping you, kind of traverse this complex healthcare system and love you well, along the way. And I think ultimately, if United Healthcare did that and Cigna and Aetna and these others would do that, I think they would see a significant increase in their business, because I think that they are coming across now as enemies and not allies. And that's really a tragedy in our system.
I agree with that. And most of my practice, I was in private practice, which I love because I could do whatever I wanted for my patients. And you're right, a lot of it's small things, like a mom would come in for a postpartum visit. I always say, please bring your baby in. I want to, see your baby and talk to him. And then I always say, if you're breastfeeding, why don't you stay in the room, breastfeed the baby before you go? They love that. Now my staff hated it because they're like, "You just tied up an exam room. You're going to be behind." I'm like, it doesn't matter. They're going to remember that. It looks small, or a lot of times the moms would show up on the wrong day. It's, your first child, it is such a game changer. It takes you an hour to get ready to go anywhere. And they'd come in, they're crying. You're like, "It's the wrong day." I go, "No, it's not. Let's just see." I'd say we'll always see that. It doesn't matter. I don't care what day they come in, but all those things all those little touches are huge. You can't really do that when you're employed, because you have to see so many people. And at the end of my career, I was employed for a little bit. And it was during COVID, and I kept thinking, I'm like the worst employee because I just did whatever I wanted, and I would just break the rules. And the staff would come up and go, "You can't do that." I'm like, "Yeah, I don't really care." Like, watch me. Like, there was a dad wanted to come in, he wanted to hear the heartbeat, and they're like, "We're not letting anybody back." So I went out and talked to him. I'm like, "Are you feeling okay?" He's like, "Yeah, I'm doing great." I'm like, "All right, let's bring him back." And one of the front desk people said, "Well, if you bring him back, everybody's going to want to come back." I go, "That's good. Let them all come back." We're not going to stop the epidemic by this one man who's wearing a mask and felt good, who was like 30 years old, healthy guy, not hearing, the baby's heartbeat. And I'm like, that's what he's there for. I'm not doing that. So but I think if it wasn't during COVID, I probably would have been fired, but they just needed docs that are like, "We'll put up with this guy." So I think that was part of it.
You make a really good point. And it's like, man, if you're going to want to walk away with one thing from this chat, it's try to find an independent doc, because I think they're better. I truly do. If you think about it, independent docs have to provide you really good service because they want you to tell your friends that they really like you, and that's the way that they have to get business.
Right.
If you're a big part of a hospital system, a lot of times your customers, your patients are coming down through the hospital system. They're referred to you through that hospital system, and so you have to be good if you're independent. You have to provide great customer service. And so we really try to get our people to these independent docs, and the independent docs love our patients because they like being paid in cash. They don't like being, beholden to United Healthcare or Cigna or Aetna or whoever it may be. And so we're really trying to, see that, or we'd love to see that community of independent docs thrive and flourish.
Well, that's great. Thank you so much. And where do you see this going in terms of membership? You're really doing well. You added a lot of members last year. Your database is huge because you're just going to get better and better at managing cost and getting the system down. And where would you like to see the growth of membership go in the next, say, 3 to 4 years?
Yeah, our goal is 50,000 this year. We have 25,000 now, so 50,000 by the end of the year. 100,000 next year, 200,000 the following year. We basically want to double the next 3 years, which I think is very, very reasonable to do. We almost tripled last year, so I think this is very doable. I think we will probably open it up to more people. We're going to have a diabetes program that we're going to roll out here in 2026 for type 2 diabetes. 25 cents of every dollar of our healthcare spend goes to people with diabetes. And we truly believe that type 2 diabetes can be reversed. And so we're going to embark upon a program to help folks with type 2 diabetes kind of eradicate themselves from the clutches of diabetes, which I think is a great thing for the system and a great thing for those folks. So we're excited about that. And this cash pay database is growing. And so we've got, I think, 2.5 or 2.7 million cash prices throughout the country right now. As we get more members, we get more data. As we get more data, we can get that data to our members. And so that's really cool too, that we're able to provide that to our members. And so we're really super excited about where we're headed in the growth. February, typically we're here in the middle of February. I don't know when you're going to release this, but it's usually our slowest month, and we are just rocking and rolling so far. We're only halfway through the month, and we've already beat our budget for the month. So
that's great.
It's been a crazy run, but all because I really think that if you can provide an awesome service where people feel cared for at a reasonable price, I think that's just a winning combination. So that's what we're trying to do.
And I love your longevity discount. Is that new?
We introduced a longevity discount mid last year. And ultimately what this is, as we kind of talked before, like with car insurance, if you're a good driver, you get better rates. If you're a bad driver, you get worse rates. You can't do that with health insurance. But since we're not health insurance, we can get creative. And so what we do is we truly believe that metabolic health is kind of the key to thriving in your 70s, 80s, and 90s. And so we're really trying to get people to understand what metabolic health is and the metrics that you need to look for to evaluate your metabolic health. And so our members can get fasting insulin, their C-reactive protein, and a DEXA scan to get visceral fat, which we think are three pretty good components of evaluating your metabolic health. And if you are in kind of elite tiers in each one of those, or two of the three of those, then you get a 20% discount to Crowd Health. So we're actually trying to both incentivize people who are healthy to come and join us, but also incentivize people internally who are not metabolically healthy to understand how to become metabolically healthy. And so I think that incentive system is really important. Let's reward people for being metabolically healthy and incentivize people to go after that. So, like I said, like what we're doing in our 30s, 40s, and 50s are the primary kind of drivers of how we're going to live in our 60s, 70s, 80s, and 90s. And so the fact that people who hit Medicare, I think, have 2 comorbidities or 2 chronic conditions, something like that. Maybe it's even higher than that. Like, I think that's a tragedy. I think more people should be going into Medicare without chronic conditions. Now I kind of tell people, like, I want to live hard and die fast. I don't want to die slowly. That sounds terrible. And so let's get people metabolically healthy into their Medicare age. And, that's ultimately what we're trying to do.
No, I think that's a great idea. And then I know for listeners of the podcast, we have a special deal, a promotion code. If you put down Real Doc Speaks, then you get $99 a month for the first 3 months. which is
that's right. Yeah.
Great savings.
It's $99. It's like, come and try it out for $99.
Yeah.
And that's why we do that, is we just want people to come and try it out. We know it's way different from health insurance, and people may not be comfortable with that. But I think once you see how this works, take a look at the transparency files. We are way better at getting these bills funded than health insurance plans. We're getting 99.9% of these bills funded. Health insurance plans get, 80%, which means you have a 1 in 5 chance of getting your bill declined. I unfortunately was one of the 5, and it cost me $8,000. And so we're doing much better at getting these bills funded at a much lower price. And so I think people should really give it a look.
So health insurance guarantees bill funding, but they don't. That's really kind of the story there. And United Health, according to the Kaiser Family Foundation, is about 30% denial rates on the Affordable Care, which is crazy because they're getting billions of dollars of subsidies so they can deny a third of the care.
1 out of every 3.
That's insane.
Isn't that absolutely insanity?
It's insanity. So I love that you're getting people to think in a different way, because that's what we need to do. This system is totally non-functional. It's working and I won't say it's broken because it was designed this way. And when you look at every time there's legislation like the Affordable Care Act, any of these big acts like that, there's 2 groups that are not in the room, and that's physicians and patients. And if you look, those are the 2 groups that always get harmed. It's not a mystery. Everybody else is in there. In the Affordable Care Act, you had the hospitals, you had the pharmaceutical companies, you had, the insurance company. Everybody else is in there, and they all got covered.
And look at their stock prices.
Yes.
Go back and look at everybody's stock prices since 2010. Yes. What happened?
Exploded.
The United Healthcare has had a tough run over the last 6 months, but zoom out over the last 15 years, and it is up and to the right. It is way beyond what the S&P have done over the last, 15 years. So,
absolutely right. No, you're right.
Rich people investing in United Health, or a lot of people who are invested in United Health are now rich on the backs of the patients.
Yes.
Unfortunately, we're the ones that are getting screwed in all of this, from my perspective.
No,
ultimately why we built what we built, which is like, man, I'm tired of people getting something like 200,000 families every year go bankrupt due to a medical event, even though they have health insurance. So these are people that have health insurance, and they're still going bankrupt as a result of medical bills. And I'm proud to say, over 5 years, we'll have our 5-year birthday in April. 0 people in Crowd Health have gone bankrupt due to a medical event over the last 5 years.
That's phenomenal.
And so, that's ultimately what we're trying to do is, have people to viably pay for big and small, medical events without going into financial distress.
What has been your biggest challenge, and what has been a challenge that surprised you? Like, I didn't even see this challenge coming when you started this.
Oh, man. I think the biggest challenge, I think there's kind of 2 big challenges. One is one I knew, and one I probably was a little bit naive to. The one I knew was that, people have been, I think, psyoped into thinking that health insurance is like, that's the only way. Mm-hmm. Health insurance is the only way I can pay for these medical bills. And if I don't, then I'm totally, financially malfeasant. It's one of those things where,
mm-hmm.
And so I have to get people over that hurdle of being like, hey, actually not having insurance, being uninsured is okay. And it's actually better. You're going to get better prices. And now that you have Crowd Health, you're much more likely to get those bills paid. That's a really hard thing
mm-hmm.
for people to grasp, because they always think like, what about the big one?
mm-hmm.
What about the NICU baby, or the cancer case, or the automobile accident? And so now that we've had hundreds of those events, and we've shown that we can viably get these things funded, we are starting to get through that hurdle. And that's the one I saw. I kind of knew that was going to be the case, and so we've done all these things to build trust with our community, which have been super helpful. The one that I was a bit naive to, I knew it was out there, I just didn't know to what extent, was regulatory. These health insurance plans don't really like what we do, funny enough. And they are oftentimes the ones who will rat us out to regulatory agencies. And then we have to spend a bunch of money, addressing a bunch of regulatory concerns. Unfortunately, we're batting 1,000. We've had, a half a dozen, regulatory interventions, and each time the state has come out and said, "Yep, you're right. You're not health insurance. You're doing everything legal, and we're doing it right." And so we spent a lot of money on regulatory attorneys, make sure what we're doing is right and by the book, and we abide by all the laws and all these kinds of things. And so that's one that I didn't know was going to be quite as expensive as it has been. But we're thankful that we're still in all 50 states and providing service in all 50 states, Puerto Rico, U.S. Virgin Islands, all kinds of places. And we actually have people in, I think, 22 different countries now that use Crowd Health. So we're growing, and it's been a lot of fun despite some of the regulatory hurdles.
Now, is the regulatory hurdles, is that the state level or federal?
State level.
State level. Okay.
Yeah.
The insurance commissioners kind of.
Insurance commissioners.
Okay.
Yeah. If we go direct to consumer, that's on the state level. If you go to corporations, that's on the federal level.
Okay.
And we are all direct to consumer. So we don't do any corporations.
Okay.
And so that would be a state level type of deal.
Okay.
So, we're through, a half a dozen of the 50. But, given what we have seen, especially given the states that have inquired, they're some of the bigger states with bigger insurance organizations who did 6 to 9 month deep dives that cost me somewhere between $50,000 and $100,000 a piece to fight. They've done pretty deep audits of what we do and have come out with the other end being like, "Yep, you're doing everything by the book." So we think that's a pretty good indicator of how the next 44 will go.
Well, that's good. And one of the other secrets of health insurance is that most states have one or two major health insurance companies that control the state. It's almost as if they decided to split it up at a poker game someday. But most states, the same thing. It's like I'm in Florida, and Blue Cross Blue Shield really runs a commercial market. That's who controls it. There's not and people don't get that. You look at, it's a monopoly both for the health insurers and same thing with hospital systems. You have a couple, usually in most towns, you have 2, maybe 3 big healthcare systems. And
yeah, that's true. I mean, it's oligopoly against oligopoly oftentimes. It's monopoly against oligopoly. So it's one of those things where you've got these big, huge companies who are dictating what the price of our care is going to be, and both sides of the equation actually want the price to go up over time. And so again, it's the patient who's the one who gets stuck with the bill of that, unfortunately.
Absolutely. And I'm glad you put in that was a great video, by the way. I love that AI video. that was hysterical and right on the money. I was laughing, and it's crazy with and it was funny that we had this shortage of salt water in a bag. We can put men on the moon, but we can't put salt water in a bag.
Yeah, exactly. Or we can, it just costs $5,000.
Yeah. But the regulatory capture is huge in healthcare. Yeah. And I'm glad you brought that up because that affects everything. And when you get these big systems are really good at managing the regulations, and in the large companies, the super large companies really seem to get a pass on all these rules, and smaller don't. I mean, there's selective enforcement of all these. So I'm glad you're surviving that. That's awesome.
They have a lot more money to spend on attorneys than us little small guys. It's pretty sad that, you get attorneyed out of innovation. But it's true. So far we've done pretty well with it.
That's right. And I'm saving my big question to the end that I have to ask you, Andy. So this very serious question, could you please tell us what happened with the house that you were renting in Northern California?
No. Yeah, this is a funny story. So I was out at Stanford for business school. And if you've seen the movie, The Social Network, Mark Zuckerberg moves his buddies from Boston to Silicon Valley. And there's kind of a subplot of the movie where Eduardo, his co-founder, has to go get, I think it's $16,000 or $18,000 from his dad, to pay for the house that they're going to stay in Silicon Valley. Well, that house was my house. We went between our first year and second year of business school. We went out and did our internships, and we rented our house to Mark Zuckerberg and his buddies. Back in, this was 2005. So kind of a funny, small world. So our house was in that movie, The Social Network. There was no zip line from the chimney, but a lot of the other shenanigans that went on in that movie, I think actually did happen in that house.
You know what? I've not seen that movie, but now I'm going to see it because now I want to see the house.
Go take a look. It's pretty funny. It's very entertaining.
Awesome.
It's a good entertaining movie.
That's awesome. So, and that stuff I learned from your website. So you've got the best website going in healthcare, and and you know what? You have to have fun in healthcare. You have to enjoy each moment. And I love that you're doing that. Obviously, you're caring for your community, and that comes across. You can't hide that.
I appreciate that.
Absolutely. And thank you so much for being here. I love what you're doing. Really respect everything that you're doing. And I love that you're working hard to give Americans cost-effective alternatives.
Well, thank you for having me on, and thank you for your battle for healthcare freedom, online and offline.
I'm having a good time with it. And the good thing is, when you're an independent person, you could do whatever you want. You could say whatever you want, and just, and I figure if people aren't getting upset with you, you probably aren't pushing hard enough. So that's great. But thank you so much. And I want to thank all the listeners, and please let me know in the comments if you have any other questions, and please like and follow for more, and we will see you next time. Thank you so much.